रुक जाओ, मैं ऐसे कर दूँ ना लैपटॉप।
हाँ वो ठीक है।
आप इधर बैठ जाओ। लाइव चल रहा है ना।
A very good afternoon to everyone, and I welcome you all for today's webinar session on basic infection control practices in COVID-19. And we are very glad to have Dr. Suniti Ganju ma'am, who is Associate Professor at Sri Lal Bahadur Shastri Medical College and Hospital, Nerchok, and ma'am is also the State Nodal Officer for Biomedical Waste Management in the Department of Health and Family Welfare. So we are very glad to have ma'am. Ma'am is a very learned speaker, and I'm sure everyone will benefit from ma'am's today's session. And I once again welcome you all on behalf of my institute, State Institute of Health and Family Welfare, Parimahal, and our principal, Dr. Neeraj Mittal, sir. Thank you.
Thank you very much, and a warm welcome to all the participants. And I'm also thankful, Mayank, for giving me an opportunity to talk to you and the students here, and all those have logged in. So I'm also thankful to you, and also my thanks to Dr. Neeraj Mittal. So today we are going to start the topic on in basic infection control practices. It's a very basic topic which we need to work on, and I will try to give my insights on the basic infection control practices and COVID-19. So the outline of my topic will be, after a brief introduction, I'll talk about hand hygiene, respiratory hygiene, physical distancing, universal masking, and infection control practices. So as we all know that COVID-19 is a global threat, and it represents the third coronavirus associated epidemic, which has emerged from a species leap from the wild animals to humans. The first one was SARS, that is severe acute respiratory syndrome, in 2003. And the second one was the MERS, that is Middle East Respiratory Syndrome, in 2012. And now we are facing the COVID-19. At present, there is no effective treatment for COVID-19, and the only thing what we have is intensive, preventive, and control strategies to mitigate COVID-19. Coronavirus, as you all know, is an RNA virus, and it has a size of about 60 to 140 nanometers. Its appearance is like a solar corona, and it has a lipid envelope. I'm just going into the basics because these are important for the infection control practices. The mode of transmission is the average incubation time is 2 to 14 days, and the virus spreads from person to person, and the mode of transmission is droplets, contaminated hands, contaminated surfaces, and between people who are in close contact, that is within 6 feet. So this is a pictorial diagram of the mode of transmission. We can see that it is from the zoonotic, that is the bat and the pangolin. It has come to the humans, and from the humans it could be either in the form of small droplets, large droplets, direct contact, and contact with contaminated surfaces or fomites. And then human to human transmission can happen because of all these routes of transmission, but we are not sure about whether it is transmitted by blood, that is blood transfusion, or organ transplantation, or even transplacental, and what will be the effect on the pregnancy outcomes. Again, it's important to know that even a patient who is pre-symptomatic, that the virus, that the patient doesn't have any symptoms, or an asymptomatic patient who doesn't have any symptoms can spread the infection. It's a stable virus, and it can remain viable in the form of aerosols for 3 hours. On copper, it's for 4 hours. Cardboard, it's 24 hours. Plastic and stainless steel, it can remain up to 9 days also. It does survive in the stool and the urine, and it is stable in feces and urine at a room temperature of 1 to 2 days. It's more stable in the diarrheic stool because it has a higher pH and can remain up to 4 days. Now let's have a look at the COVID-19 R0 or the R0 number. Is it a magic number that we have been talking about? So the COVID-19 RO number is the reproductive number. That means the average number of secondary infections that are produced by an infectious case in a population where everyone is susceptible. It is the beginning of the epidemic where everybody is susceptible, and the average number of secondary infections that can be produced by a single person. And this RO or the R0 or the R0 number measures the transmission potential of a communicable disease. When RO is more than 1, it means that an infected individual is expected to infect more number of people, and the infection will rise exponentially and increase in the R0 number. And the disease is expected to spread through the susceptible population. When the R0 number is less than 1, that means each case transmits the disease to less than one individual, to one or less than one individual, and the disease is expected to die in the population. That means it won't spread more. Now another number is the RC number, that is COVID-19 RC number, which is the control reproductive number. COVID-19 R0 is constantly modifiable during an epidemic by the control measures. That is, what is the duration of contagiousness or likelihood of infection per contact or the contact rate. And the control reproductive number is the RC number, which is the presence, which shows the presence in by the control measures. So if the RC number can be maintained below 1, that means the disease will eventually be eradicated. And that is what is our focus on COVID-19, that we are trying to maintain the control reproductive number, that is the RC number, below 1. Now WHO estimates of the R0 number were in the range of 1.4 and 2.5 on 23rd of January 2020. However, there are various studies which showed the range from 1.5 to 6.68, and even the reports of a British businessman with COVID-19 which transmitted the infection to 11 people in a French chalet. In Wuhan, after 30 days of counter measures, the preventive measures they took, the R0 number was reduced to 1.58, and that is how they were able to control the epidemic. Another example is the Diamond Princess cruise ship, in which the basic reproductive rate was initially 4 times higher on board, that is around 14.8 in comparison to the R0 number in the epicenter in Wuhan. There were about 3,700 passengers on board, and with intervention, the outcome was that 2,307 cases were prevented. If they had not taken any intervention, that was without intervention, from 21st Jan to 19th Feb, 2,920 out of the 3,700 patients would have been infected. So that means they were able to take care of 79% of the on-board passengers, and this is how they could lower their R0 number to 1.78, and it was because of the isolation and the quarantine measures that prevented the infection in 2,307 cases. Another important topic is herd immunity. Herd immunity is the fraction of the population who need to be infected before the immunity can be achieved. For example, if the R0 number is 1.66, a population of 40% needs to be infected to achieve herd immunity. So now with this in mind, this is the background, small background which I have given you And to summarize this, the first thing is that coronavirus is an enveloped virus. It has an envelope. It is primarily transmitted from person to person through droplets, and even an pre-symptomatic or an asymptomatic person can infect or transmit the infection. The aerosols can be emitted while we are talking or breathing. Aerosols float or drift around in the air for up to 3 hours, and the spread can happen from fomites, that is, contact with infected surfaces or objects. The herd immunity is yet to be achieved. There is no vaccine available at present, so our main aim is on basic infection control measures. So this is how we need to control this epidemic now. So going on first to hand hygiene. Now, what are your hands carrying? Do they carry any microorganisms? Yes, there's a resident microorganism, that is the resident flora, which is the normal flora, and it is helpful to the to the body, to the human body, and it is usually deep seated in the epidermis, and they do not cause any infections and cannot be removed also easily. But now once we touch any contaminated surface, we touch any fomite, there is the presence of the transient microorganisms, which is not the part of a normal flora. It represents recent contamination, and this is what causes infection, and it is only removed by a good hand washing technique. Do we touch our face all the time? Yes, we do it. And this is the easiest path of the SARS-CoV-2 transmission, and as we know that the eyes, nose and the mouth are the transmission routes, and several studies show that average face touch is about 16 to 23 times per hour, and even in medical professionals it is about 19 times per 2 hours, and almost half of the face touches involved are the mouth, nose and the eyes. So out of all the touches, half of the face touches is for the mouth, nose and the eyes. So the bottom line is avoid touching your face, increase your awareness where your hands are actually, and maintain hand hygiene. Clean hands count every day of the year. Now, infection can be caused by direct contamination of susceptible sites, that is, the surgical wounds, intravascular cannulation sites or catheter drainage systems. If our hands are infected, directly we can contaminate the susceptible sites, or the potential pathogenic organisms can establish themselves as temporary or permanent colonizers of the service users, and these transient microorganisms are easily transmitted from healthcare workers' hands to others to vulnerable service users' sites or by touching the contaminated surfaces. Now, hand hygiene is the simplest and the most effective procedure. Adequate hand hygiene has to be performed, and the most important things is the skin integrity is to be seen. If there is a cut or an abrasion, it is to be covered with a waterproof dressing. The nails are to be kept short. Nail brushes should be avoided. If used, it should be single use and preferably sterile, and avoid using wrist and hand jewelry. What are the levels of hand washing? Hand washing levels are routine social hand washing, aseptic hand washing and surgical hand washing. I will only be talking about routine social hand washing. So this is a picture which you can see that it shows the red color shows the most frequently missed sites when we wash our hands. The pink is the less frequently missed, and the white is the least frequently missed site when we wash our hands. So what does hand washing do? It removes the dirt, organic matter and most transient organisms which are acquired through direct contact with a person. And washing with soap, it's not only just with water, is vital to proper hygiene. Both are important, the soap as well as the water. They are complementary to each other, and it's not that simply washing hands with water will help. So for a proper hand washing, we need to have soap and water, and a tippy tap hand washing station could be of help to promote hand washing and awareness. When you have such hand washing stations, people or the healthcare workers would like to wash their hands often, because it depends upon the attitude as well as the availability of the things so that we could wash our hands. So there are certain steps in hand washings which I'll be talking about. First, I'll talk about various things like soap, water, and the hand wash. So water, what does water do? It is a powerful agent to rinse away the dirt, but it cannot remove the soil or organisms that are attached to the hands. And this is what the soap does. It is effective and maximizes the rinsing effect of the water. Now the variables in the hand wash and the use of soap are time, the type and the make of soap, and the quantity to be used for hand washing. According to CDC, the scrub time is 20 seconds. So it is 20 seconds you need to actually scrub. It doesn't include the time when we are washing the hands under water. So it is the scrub time which is 20 seconds, and it is equal to singing the happy birthday song twice. If you sing this song twice, it is just 20 seconds. Or if you don't want to sing the song, we can just say a prayer which I usually say, that is Dehi me sobhagyam arogyam. Dehi me so I'm just missing it. So this, if we spell out twice, it is also up to 20 seconds. It means that, "O my Lord, give me happiness, success, and keep me away from the disease." So if we sing it twice, it means it is 20 seconds. And the type of the soap, whether it is antibacterial or which soap should be used, all soaps per se are antibacterial. Then whether we want to use a bar, liquid, gel, or a foam soap, all are good soaps. And how much is the quantity which we use? That is the optimal amount of the liquid soap. It has been seen that the lowest dose is 0.7 ml. That is a small glob or a dime which can be used from the liquid soap. It balances between the required effectiveness and the economics. It has been said also that 0.4 ml can be used, but as per se, the 0.4 ml only covers 53% of the hand surface area and does not produce a cleaning result better than when we use only water. So if 0.7 ml is very difficult to calculate, so we can use 1 to 2 ml of the liquid soap, which can be used for hand washing. Foaming hand soap can also be used. The second thing is the hand sanitizer. Do we use an alcohol-based or a non-alcohol-based hand sanitizer? Alcohol-based hand sanitizer is ethanol, isopropyl alcohol, propanol, or its combination. It's low cost, it has a rapid action and is efficacious. The percentage should be more than 60%. So 60 to 95% of alcohol is used, and it is effective and reduces the infection transmission. Ethanol is more effective than isopropanol, and isopropanol is more effective than propanolol. So ethanol is the best alcohol-based hand sanitizer. It is effective against enveloped viruses. Its effect against the non-enveloped viruses is debatable. Coronavirus is a lipid virus, which we have talked about before. So it is effective against coronaviruses. And it effectively inactivates the COVID-19 on inanimate surfaces, that is metal, glass, and plastic. The non-alcohol based hand sanitizers contain the active ingredient, which is benzalkylonium chloride, which is about 0.1%. But the drawback using this is that it does not dry out the hands, and the efficacy data is limited. And still, we do not have any recommendations drawn for using the non-alcohol based hand sanitizer, though it is less irritating than using alcohol on the skin. It is less worrisome regarding the flammability issues and the abuse potential. And also similarly, it is not effective against non-enveloped viruses. So hand hygiene is the gold standard, and the alcohol-based hand sanitizer with at least 60% of the alcohol should be used. There are 5 movements of hand. One is before touching the patient. Second is before doing any aseptic or clean procedure. The third is after the body fluid exposure. You are exposed to that, so like you are touching the drain or the urine bag, or after touching the patient, or after touching the patient's surroundings. So the steps 1 and 2, that is before touching the patient and doing a procedure, protects the patient, while as steps 3 and 5, that is touching the body fluid, touching the patient, or touching the surroundings, is protection to yourself. Now let's see the actual hand washing procedure. This is a pictorial diagram. We can see that we have taken a small amount, about 1 to 3 ml of the liquid soap. First, we are doing with the liquid soap. If we use the soap and water, a small blob is taken, and then we have to rub hands palm to palm. So first important thing is rubbing the hands palm to palm. Then back of the the back of the hands, so that the web spaces are covered. Then rub the palm with the fingers interface, so that the web spaces are covered. The fifth step is that we will take up the knuckles, and then the thumb, and then the middle portion of the hand, that is the depression of the hand, which I had shown in the earlier picture, are usually missed. So, and then we rub the wrist. So this is the main steps in hand washing. And finally you wash the hands, that is rinse with water. You can use an elbow tap and close the tap with an elbow. And we have to dry our hands. We can use a single towel, which can be thrown away, and then the time for this is 40 to 60 seconds. This takes 40 to 60 seconds, but the basic time, that is the scrub time, is 20 seconds. The rest is all washing, drying is about other time. Now if we use the alcohol rub, it depends, it is given on the kit insert also, that how much you have to use for the alcohol hand rub, but usually it's about 3 ml. Again the same steps, and you have to rub the hands so that they are dry. So once they are dry, the hands are safe, and it takes about 20 to 30 seconds. And we have also to note that if we use the alcohol rub or the hand sanitizer, the hands should be clean. If the hand sanitizer may not be effective when the hands are visibly dirty or greasy. So most important step is hand washing with soap and water, and in between you can use the hand rub. The second portion is the respiratory hygiene. Now respiratory hygiene is we have to contain the production of the droplets. So what is a droplet? It is a water droplet with its various inclusions which depend upon the generation, whether they are naturally produced or they are artificially generated droplets. So natural would be while we are talking, we are breathing, sneezing and coughing. Artificially would be while we are doing certain manipulations, like we are doing an intubation or we are doing a suction of the respiratory tract. So we may generate artificially the droplets. The droplets would include various cell types, that is the epithelial cells, or electrolytes which are contained in the mucus and the saliva, that is sodium, potassium and chloride, and certain potentially infectious agents. And if we are doing a spray of salbutamol, that is the drug spray, to a patient, then it could contain even the molecules of the drug. So the droplet would be the material, that is the inclusion, which has a coating of the water, mucus. So that is how the droplet is formed. Now let's see how much droplets we are producing. Sneezing produces 40,000 droplets. The size is variable. It could be 0.5 to 12 microns. Coughing produces 3,000 droplet nuclei. Talking for 5 minutes produces about 3,000 droplets. And loud talking means it would produce more of droplets, as aerosol emission increases with the loudness of vocalization. So louder we talk, more aerosols are transmitted. Super spreaders are individuals who can infect others by generating more droplets and more secondary traces than is expected on the average. So it depends upon the infection control, the viral load. So super spreaders, we have to be careful with the super spreaders. Now, what is respiratory etiquette? Now, respiratory etiquette is we have to cover the nose and the mouth while we are coughing or sneezing with a tissue. Dispose of the used tissue in a bin which has a cover, it has a lid. Perform immediately hand hygiene after contact with respiratory secretions. If now WHO says that if tissue is not available, cough or sneeze into your elbow and not into your hands. So this I would just try to elaborate that though it is widely recommended by WHO as an intervention, but I would feel, and as others also feel, that arm sleeve barrier may not be able to ward off the potential risk, and it can remain viable from hours to days, as we know that the coronavirus remains viable on the cloth. So it can be a source of infection. Then there's a new custom that we greet with elbow bumps. So then that has to be avoided, and because it said you don't shake hands, so elbow bumps were people used to greet with them. But then if you have sneezed into your elbow, so that could be also a source of infection. Besides, elbow bump doesn't place a person within 1 meter of the distance, and it's not convenient to change the clothes frequently or disinfect the sleeve after coughing or sneezing into the elbow or the upper sleeve. So the baseline is that we have to take only contact precautions every time. So sneezing by covering the face and then throwing the tissue would be a better option. The other things we have to say that no handshakes, greet with a namaste, no spitting in the open, that the ground can be contaminated with aerosols as the droplets fall down into the on the ground if an infected individual spits with a virus-laden saliva. And this is the time when we can overcome some bad habits for a healthy future, so we don't spit in the open. Now the third one is physical distancing. Physical distancing is a non-pharmaceutical intervention, and it has a strong potential to reduce the magnitude of the epidemic peak. It can lead to smaller number of cases overall. So we have to have a safe distancing, which is about 6 feet, that is 2 meters. And we can see if a normal behavior, one person infects 2.5 people in 5 days and 30 people 406. But if the 50% less contact, only 1.25% will be infected, and then in 30 days it will be 15. And if we have 75% less contact, only 0.6, only half of the percentage of the people can be infected, and only 2.5 people will be infected in the 30 days. So physical distancing can help to curtail the spread of the infection. And people can spread the virus before they know they are sick. And so the main bottom line is that we have to stay 6 feet away from each other, even if you have symptoms or even if you don't have symptoms. The main thing is be away for at least a distance of 6 feet. What will physical distancing do? Physical distancing will flatten the curve, which has been talked a lot, and we can see with uncontrolled with no physical distancing, the cases would rise, as is shown in the blue graph line, that it shows uncontrolled transmission. But if we take certain preventive measures, the curve could be flattened, and this could be beneficial in two ways. One is that the epidemic peak will be lowered, less number of infections would be there, and the pressure, the burden on the healthcare system will also be reduced. Now, just a graphic representation of physical distancing. Let's see a simulation. There are 200 people in a town with one sick person. When a healthy person comes in contact with a sick person, the healthy person can become sick. So we'll observe the features, the differences in the 4 physical distancing measures. That is, when we have no restriction, we have an attempted quarantine, we have moderate distancing and extensive distancing. The slope in the red curve represents the number of 6 people. So we can see these are the bouncing balls which I have taken, and we can see the change over time in these people who are, the total number is 200. We can see that when there are no restrictions, the number of infections goes on increasing till all are infected, all the 200 people are infected, and hopefully they will get recovered. I have not taken the deaths in it, so they get recovered. And so, but the peak is reached very early. Then if we take attempted quarantine, the middle line represents that we have given a quarantine, but then once you open the quarantine, you can see that these bouncing balls, the simulations, will spread the infection into the people who did not have any infection. The change over time says that the infection is at a lower level, but then the peak could be reached there could be a second peak also which can reach there, and finally the peak settles down, the infections settle down, but the number of sick people are more. Then if we have moderate distancing, like we are talking about doing the work also, but having a distance of 6 feet, we can see that the change over time is that the infection spread is very slow. We can see how slowly the infection is spreading, and there are healthy people also. The sick people are very few in this, and finally the recovery rate is also high if we have moderate distancing. Now, if we have extensive distancing, that means the complete lockdown which was initiated, we could see that there were very minimal cases, very minimal cases during this period, and they could get recovered also because they had ample attention and they could get recovered also. So this is when we have extensive distancing, that there are hardly any cases and they get recovered also, and the rest are healthy because they are not going out anywhere. So with this, we can show that if we stay away from other people, then we can manage to curb this epidemic. We have to stay away from people who are not from your own household, both indoor as well as at outdoor spaces. And moderate social distancing is usually better. It works better because we have to go to work also. And in extensive physical distancing, there is a complete lockdown, though it works the best for all, but moderate social distancing is usually better. And as COVID-19 has a multifactorial complex transmission risk, a combination of strategies have to be adopted. That means hand washing, till now we have seen, then we have seen physical distancing and respiratory etiquettes, all have to be dealt together. Now we come to the use of mask. So it's important, like we have universal work precautions, we also have universal masking. So why COVID-19 is spreading fast? We have 3 main reasons. That is, he's my colleague, so I can speak to him without a mask. He's my close friend, so I can speak to him without a mask. They are my relations, so I can speak to him without a mask. So these are the major 3 mistakes what we are doing. And if we try to use the mask everywhere, every time when we are seeing anybody, then we can save ourselves as well as the society. Now, what does use of the universal masking do? So masks reduce airborne transmission, and the infectious aerosol particle which is released during the breathing and speaking by an asymptomatic infected individual, we can see how much of the aerosol infected particles are released. It is both, the droplet size is variable, it is from 0.1 to 100 nanometers, microns, and it is transmitted to the healthy persons also. So there is maximum exposure when you don't use the mask. If both are using the mask, there is minimum exposure. So the mask is actually, once we use the mask, it is not preventing ourselves, but it is preventing the other person from getting the infection. So if we both are using the mask, it is that we are preventing the infection in getting into each other. Now, what are the types of masks? A little word about the mask. We have medical masks and non-medical masks. The medical masks, I'll only be dealing with the surgical as well as the N95 mask, though you have many types of masks. And in the non-medical mask, we have the cloth mask. The medical mask is a surgical triple layered mask which we commonly use, and it's a 3-layered mask. It is important that there are 3 layers in it. It has a middle layer which is the barrier to the germ and the inner layer for moisture absorption. The outer layer is a fluid repellent, so it doesn't allow the particles to get in, the fluid particles to get in. So the middle layer is actually the barrier to the germ, and the inner layer is moisture to absorption. Whatever we breathe, it doesn't get wet. So it creates a physical barrier between the mouth and the nose of the wearer and prevents the potential contaminants. The second important mask is the N95 mask, which has been talked a lot. It comes in the papers, the other social media. It is an N95 respirator which protects the person who uses it, and it has a very efficient filtration capacity. It have to have a very well fit, and the respirator blocks at least 95% of the very small microns. It has to undergo certain tests. It is bound by certain regulations around the filtration capacity, and they are all certified masks. They have a label on it, and we do not use the other masks which are just designed in the same way, keeping a respirator there. But the N95 mask has passed certain tests, and then we can use it. And N95 respirators are not designed for children, so we don't have any masks, N95 masks for the children. The N95 mask, because of the shortage of the N95 mask, we can reuse them. There is an extended use, a reuse of these masks. If we have 4 masks, we can number them 1 to 4 and use the different masks each successive day, and let the mask dry out, for 96 hours before using. But it is the same person who will be using his own masks. These masks, as I have told you, are tested for fluid resistance, the filtration efficiency, the flammability, and the biocompatibility. It is used only by the healthcare workers, and they should not be shared. Now we have seen N95 masks being used as is shown in the picture. It's always hanging around the neck. So don't wear the N95 mask like that. The N95 mask is not to be used when it is wet or soiled or there is any air leak. It has to have a complete fit. Do not touch the front of the respirator, and do not snap the straps, as it can spread germs. That is a wrong way to use that mask, and you cannot share the mask. N95, it is your mask, and you have to use it. And don't leave the N95 respirator hanging around the neck. This is very commonly what we are seeing, and we should not put the mask around the chin, because that is the most hazardous point where we are using it. So how to wear a medical mask safely, we have shown in the picture. So most important is first is hand wash and then use the mask. It should completely cover your nose, your mouth, and the chin. And for the non-medical mask also, hand wash and use the mask properly. That means it should cover the nose, cover the mouth, and cover the chin. And the don'ts, we have seen that don't throw away the masks here and there, even the cloth masks also. Now the cloth mask, we have a guidance which has been issued for the use of cloth mask. It is for the general public, and all people above 2 years of age and older should wear a cloth mask in any public setting. So what I have talked about till now was the medical mask and the N95 mask, which is used by the healthcare workers. And for the general public, we have a cloth mask, and it has to be worn by everybody who are above 2 years. All children 2 years above. For less than 2, we don't have. So they have to be used, and again, for the children less than 2 years or anybody who has trouble in breathing or unconscious may not use the mask. And N95 masks are not used for the general public. The cloth masks may not protect. This is very nice saying that the cloth mask covering may protect them, and their cloth mask, their face covering or the cloth mask may protect you. So it is both way, it is mutual. The cloth masks have also been tested and are made available. In India, we have the CITRA certified cloth masks, which also have an bacterial filtration efficiency. They are reusable. It's about 7 layers, and it's also splash and fluid resistance, and it is reusable up to 30 gentle hand washes. So it's not to be used at very high speed. You can laundry them, of course, and they should be dried in sunlight. Now, masks have become the new normal, and they should be provide some protection, and they have to have the protection results from the deflection of the particles, the filtration of the aerosols, and the complete fit. And it has been seen that a combination of cotton with other fabrics like silk, flannel, or chiffon can be used, and the filtration efficiency is nearing N95 mark, that is about 95% of the filtration efficiency, and fit can be enhanced by using a lining or a tape outside the mask or use of fabrics that deploy low-level electric charges to neutralize the virus particles. So protection is important. Then scalability, that means we have to have the available materials which can be used. It should be comfortable. Reusable also, that we have used elastomeric masks are also available. And finally, the style, because now it is the new normal, so it should be fun wearing the mask, and it should be cool, but at the same time it should offer some protection. Now we come to the last infection control measure, that is disinfection practices. In the disinfection practices, it's very important that both the healthcare and the non-healthcare settings are disinfected. In the healthcare settings, it includes everything, that is furniture to fixed items inside the patient care, the restroom, the medical equipment, which includes your blood pressure cuff, stethoscope, to wheelchairs, and many more, whatever is in the hospital. In the non-healthcare settings, it is basically the sinks, the public toilets, electronic gadgets which we are using, the furniture, countertops, stairway, rails, floors, and the walls. So these have to be a disinfectant. It's an interesting study which has come very recently, that they have used a labeled phage, that is a marker, and they have seen that the virus can spread from a single contaminated door handle or hand of one infected person to the people and the equipment throughout an office building within hours. So you can see how much we touch the surfaces. So it is very interesting to note this, and we should really comply upon the on the disinfection practices. Now, in the disinfection practices, the first important thing is that we have to clean the whether it is the bench top or the floor. First thing is to clean with water and soap with some brushing. This helps to reduce the pathogen load, and then also a little bit of organic matter is removed, because if we pour directly the disinfectant or the germicidal chemical, then it can impede its properties, the germicidal, the killing properties of the disinfectant. So first step is cleaning with water, soap, and some brushing. This will reduce the pathogen load as well as help the disinfectant to be more effective. Then a chemical disinfectant, we'll only talk about two disinfectants, that is the alcohol and the chlorine, which is applied to the surface or the clean surface. After that, we apply the two things. Now we talk about the chlorine-based products, that is sodium hypochlorite or calcium hypochlorite. It has an active ingredient, that is hypochlorous acid, which is the antimicrobial compound. And the hypochlorite displays a broad spectrum of the antimicrobial activity, and it is very effective against common pathogens as well as the coronavirus. The chlorine solution, very important to note that the chlorine solution should be stored in opaque containers. It should be well ventilated area and a covered area and not exposed to direct sunlight, and it has to be prepared freshly every day. The calculation for sodium hypochlorite is the percentage of chlorine in the liquid sodium hypochlorite, which is available in the market. That is the percentage of the chlorine in the liquid. If it is 5%, then divided by the percentage of the chlorine which is desired minus 1, that will give you the total part of the water for each part of sodium hypochlorite. For example, if it is available as 5% of hypochlorite, then we divide, and our desired concentration we have to make 0.5%. We divide it with that, subtract 1, and that means that 9 parts of the water for each part of sodium hypochlorite is we can make it. For calculation for calcium hypochlorite is also in a similar way. That is, if our desired concentration is 0.5%, then we divide it by 35% in the hypochlorite powder, because it contains it's in the powder form. So then it will be about 14.3. Then it means that we dissolve 14.3 grams of calcium hypochlorite powder in each liter of water to make a 0.5% chlorine solution. So these are some of the calculated hypochlorite concentrations. So if we have available chlorine is 3.5%, then 1 part of bleach to 2.5 parts of water. If we have 5%, then sodium hypochlorite liquid, 1 part of bleach to 4 parts of water. If we have sodium dichloroisocyanurate powder, that is 60%, 17 grams to 1 liter, and bleaching powder is usually 70%. We have 7 grams to 1 liter. So we have several different bands available. We need to follow the manufacturer's instructions also. Then sodium hypochlorite, we usually use 1% and 0.5%. So 1% would be 200 ml in 800 ml of water from 5%, and 0.5% would be 100 ml in 900 ml of water. The contact time is 30 minutes and it has to be prepared freshly. So these are the concentrations again for 0.1% of sodium hypochlorite, that is 5% would be 20 and 980 ml of water. How do we do environmental cleaning? We have to wipe down. The important thing is we wipe from top to bottom. That means the top is the cleaner to the bottom area. So wipe down all accessible surfaces of the floor, furniture, fittings, that is with 1% hypochlorite. We have certain high touch surfaces and some low touch surfaces, and the protocol for cleaning them is given in this chart. The high touch surfaces are doorknobs, telephone, call bells, bed rails, stair rails, switches, wall areas, and if there's a clinical area where we have a suspected case of COVID-19, then they have to be cleaned 1 to 2 hourly. Or if there are no suspected cases, but a case is kept, then it is 2 to 3 hourly, and in the non-clinical areas it is 3 to 4 hours. If it's a low touch surface, that is a wall, mirror, then mopping is to be done. If it's placed in a clinical area, 2 to 3 hourly, or where no suspected or confirmed case is kept, it is 3 to 4 hourly, and in the non-clinical areas it is once per the shift. So these are the guidelines which have been issued by CDC. Now important questions are spraying or fogging. Now disinfection by spraying or fogging is not recommended. Spraying disinfectants is risky to the eyes, causes skin irritation, and has serious adverse health effects. Formaldehyde is not recommended, as we use it for spraying or fogging in the public. There are certain no-touch technologies which are available, like vaporized hydrogen peroxide can be used, or UV radiation can be used, ultraviolet radiation can be used. These technologies do supplement, but they cannot replace the need for manual cleaning procedures. And spraying or fumigation in outdoor spaces such as streets or marketplaces is also not recommended. The most important thing is that you have to wipe down the bed rails, the stairway, the the grills which are there put up. Spraying or fumigation in outdoor spaces also not recommended, and spraying, like we have this in the tunnels. We had these tunnels which were made. This is also not recommended in any circumstances. So frequency of cleaning of environmental surfaces which we have in the patient area, it's done twice. In the inpatient rooms, it is done thrice. In the unoccupied inpatient rooms, it could be upon discharge and transfer. In the outpatient or the ambulatory rooms, it could be in the about once daily. Then hallways and corridors, it is twice daily, and patient bedrooms, toilets, it has to be done twice. And if it's a shared toilet, it is done thrice daily. This is the guidance given by CDC for WHO for frequency of cleaning of environmental surfaces. Now, disinfection will, if we use these disinfectants like ethanol and chlorine based products, it will achieve, a reduction in about 3 log reduction in the human coronavirus, but if it is used properly. So ethanol, once again I say, it is the concentration above 60%, so 70 to 95% can be used. Chlorine based products can be used, that is hypochlorite, which is used commonly, that is 0.1% for environmental disinfection. 0.5% we use for blood and body spills. Hydrogen peroxide can be used for 0.5% with a contact time of 1 minute. So the baseline, if we really want to see what is the efficacy of these protective measures with an intervention alone and with all the interventions which have taken place. So if we have physical distancing, we can see that without an intervention, the infection would be about 12.8%. But with an intervention, that is keeping a distance of 6 feet, it is about 2.6%. If we use a face mask alone, it can reduce the infection by about 17.4%, and with a mask or respirator, it is only up to 3.1%. And if we use an eye protection, it can reduce the infection up to 5.5%. So if all these all these protective measures are used together, then it is very important, then it can have a beneficial result. So we have seen that based on the available evidence on physical distancing, face mask, eye protection and hand washing, though we cannot say which is the best of all, but at this point of time they are all effective, and if we use in combination, they really serve us better to control the COVID-19 epidemic. So these are the acknowledgements where I have taken this material from, and thank you all for listening to me, and over to Mayank.
Thank you very much, ma'am, for a wonderful and very enlightening presentation. And now, ma'am, we'll be taking up the queries, ma'am.
Okay.
Ma'am, the first question is from DPQA Mandi. And what quantity of sanitizer is required to sanitize the hand?
Okay, so as I have said that if you use a liquid soap, It is about 0.7 ml, but we can use 1 to 2 ml of liquid soap. It is about a dime size or a small blob which we can use it, but it should cover the whole hand. Once you use it with soap and water, the whole hand should be covered.
Okay, ma'am. Ma'am, the next one query is from Mr. Anil Thakur, and he's asking that why N95 is called N95.
So N95, N is a symbol for non-oil resistant, and 95 is the filtration efficiency. It is able to protect 95% of the bacteria. It filters 95% of the bacteria, so its protective efficacy is 95. So we have the N95 mask. We have N99 also. We have N100 also. N is non-oil resistant. We can have others also, R95 or R99, which is non-oil resistant.
Ma'am, the next question is from Kunjilal Sharma. Can we reuse N95 masks at the designated COVID care centers? And he also has a follow-up question. How can we reuse these N95 masks while working in a designated COVID?
The N95, as I have already said, that the N95 masks, there are two terms in it. One is the extended use and reusability of the N95 mask. But in this, if we have 4 masks issued, we have to label them, and 1, 2, 3, and 4, and we can relay them. That is, on the 4th day, use the first mask. And they have to be placed in a paper bag for 96 hours, not hanging on the walls. And it has to be placed perfectly in the closed paper bag, and after that is on the 5th day, you can use the first N95 mask. There is nothing like you can sanitize it, you can't spray anything on it.
Thank you, ma'am. The next question is from Mr. Tharwan Lal Thakur, and वो पूछते हैं मैम, क्या हम ट्रिपल लेयर मास्क को धोने के बाद फिर से यूज कर सकते हैं या नहीं?
Okay, so there are two things in it. The triple layer mask is if you're talking about the surgical mask, that is the triple layer mask, it is a single use mask. It is not to be washed. It is to be used only singly, and we do not use the surgical mask. We cannot reuse it. So that is one thing. Now, if you're using a cloth mask, we can reuse it, and it has to be washed lightly, only up to 30 washes, which is recommended. But the surgical mask is used in the healthcare settings, and the cloth mask, which we have said, can be used in the public settings. And these cloth masks, besides everything, you have to cover the nose, the mouth, and the chin.
Ma'am, the next question is from Mr. Anil Thakur. While taking samples in van, N95 mask can be reused or not?
So reuse of the N95 mask is a thing. So that is now it has that the N95 mask we are talking about reusability. That is because you have worn the mask, it is not necessary to change the mask while taking the samples. So this is the reuse of the mask, but it is the single person who is wearing that mask. So you don't have to change the mask in between.
Okay, thank you. Ma'am, the next question is from Mr. Manjeet Sharma. How to disinfect the mask after disinfect were put into the mask? We are not really sure what he's trying to ask.
Maybe I can hear it again.
Ma'am, how to disinfect the mask after disinfect were put into the mask?
So the masks are not at all disinfected, so they have to be thrown away.
Ma'am, the next question is from Kunjilal Sharma. What is the expiry date of sodium hypochlorite solution? And he also has a follow-up question. Do we have a manufacturing and expiry date for sodium hypochlorite solution?
Yes, it's given in the the sodium hypochlorite is very important because we make it freshly. So that is why we have if we have a stock solution of 5%, it has an expiry date on it. And since we are making it freshly, it is to be made every 24 hours. And only that much is to be made, how much we require. We know our daily consumption of the hypochlorite. So we prepare it freshly. And the expiry date is mentioned on it's quite stable. It's quite stable if we store it properly. That is, if we store it, in a dark place, and it's well ventilated, covered, and not in sunlight.
Thank you, ma'am. Ma'am, the next query is from Mr. Dalip Jaryal, and his query is: Can we use sanitizer on regular basis? Is it safe? Please suggest.
Sanitizer for what? Hand washing or hand rub?
Ma'am, hand washing.
So sanitizer cannot replace hand washing. Actually, you have to hand wash regularly, but in between you can use the hand sanitizer. It is quite safe, but not alone hand. Only the sanitization process. That means the hand washing, it cannot replace the hand washing. Hand washing is a must, and in between, like you are on work or you're doing something, or there is non-availability of water and soap, you can use the hand sanitizer.
Ma'am, the next question is from Vidhi Tomar. Are there any written guidelines available on the use of 0.1% sodium hypochlorite for general environmental cleaning?
Yes, I have already shown them that we are using the 0.1% hypochlorite.
Thank you. Ma'am, the next question is from Tajendra Kumari. After using 1% sodium hypochlorite solution for disinfection of furniture, majority of our inventory got corroded, including lifts. Can it be substituted or some other method is recommended?
Yes, that's very right. That hypochlorite does, cause corrosion of the metals, and we have to use it very, very cautiously. So the important thing is we don't have to spray it. We have to wipe it. So if we just wipe it, if we use the spray, more of the fluid remains on the hallways or on the staircases. So we have to wipe it down immediately.
The next query is from Kulbhushan Chauhan, and he says the sweepers and class 4 are deputed at designated COVID care center regularly from peripheral institutions. So, how to manage the biomedical waste at the peripheral health institutions? Uh, and he's saying that can't the DCC housekeeping can be done on outsourced basis?
In the district COVID care centers, you have deployed the sanitation workers there, but there needs to be an agreement with the common biomedical waste facility for lifting the COVID waste, which has to be labeled there and properly segregated there. And the COVID waste needs a special, that it has to be taken away every day. It cannot be left there. So it is the district administration, because the district COVID care centers are under them, so they will be looking after the the common biomedical waste facility and the agreement, so on.
Thank you. Ma'am, the next question is from Sachin Sharma, and he says that please comment on the spread of coronavirus in foggy conditions. Will the virus remain suspended in fog droplets for long hours?
This is an interesting question, actually. So in the fog, what will happen? I think it should remain there,
Okay.
but I had to clarify it.
Okay. Ma'am, the next question is from Kesh Kumar. Can the hypochlorite solution spray kill the virus in the air present in droplets of infected person?
Droplets of infected person. That means you
Yes, ma'am.
want to spray the whole area
Yes,
with the hypochlorite. No,
Yes,
we
ma'am.
don't do that. That is not the recommended procedure. That you want to spray in the area. No, that is not done.
And the next question is from Nisha Sudan. Wiping should be done with cloth or tissue paper?
It can be done with cloth. It can be done with tissue paper. Is very small. You can have wipes for it, actually, by which we can use it.
Ma'am, the next question is from Rajendra Teesal. Hypochlorite, being corrosive in nature, often corrodes the furniture surface. How to prevent it? Also, how to sanitize the diagnostic equipment surfaces of the expensive equipment?
So this is also like we can, for these, I think we use 70% alcohol. We don't use hypochlorite from them. We wipe it with 70% alcohol.
Ma'am, I'll be asking you some of very common queries, ma'am, that we have. Ma'am, can ash be used for hand washing?
Ash can be used for hand washing, as has been done in the on the other resource constrained countries. Ash has been used, Once it mixes with water, it becomes alkaline and it has a bactericidal action. So ash can be used for hand washing.
Ma'am, there is a query from Sunita Dhiman. Can sodium hypochlorite concentrate solution be kept in transparent plastic bottles?
It has to be stored in dark bottles. Hypochlorite has to be stored in dark bottles and not in transparent bottles because it has to be kept away from light.
Ma'am, what is the role of sanitization tunnels, ma'am?
There has been a lot of controversy, and people are setting up sanitization tunnels through which the person can pass. But I think it is not at all recommended because, after all, it's a human being who has to pass through these tunnels, and the spray of hypochlorite is not at all recommended. So sanitation tunnels are not recommended.
Ma'am, can COVID-19 spread from pets?
Well, it has been seen the infection has COVID-19 has been seen in some of the pets like dogs. So if a person is a vulnerable patient, or it is elderly person, so we should avoid the pets. Though there is nothing not said that you have a pet to the human being, but since it has been found in the pets, in the dogs, so it is better to safeguard ourselves from these pets. And once we are doing the activities with the pet, that means bathing them, complete precautions are to be taken and hand washing has to be practiced.
Ma'am, what is the current R naught and R number for India?
So at present, the current R naught number, the RC number, I must say, that
Yes,
is the reproductive number, is about 3.4, which has come down very recently, and it has stabilized about from about 1.8.
Ma'am, we have a query from Vandana Kumari. In the COVID ward, spraying should be done or not for disinfection?
No, I'll repeat this once again, that we do not spray, use fogging or spraying anywhere with sodium hypochlorite, whether it is a ward. What we have to do is we have to clean the walls, we have to clean the floors, we have to use the wipes, we have to wipe down everything from the top to the bottom. That means from the least infected to the most infected site. So we have to wipe down the walls. We do not use a spray anywhere, whether it is a ward, whether it is the outside, whether it is a farm. We do not use any hypochlorite sprays.
Ma'am, the next query is from Bindu Rani. How to disinfect liquid waste in DCHC?
The liquid waste, if it is from the COVID patient, you have any liquid waste, then it has to be first disinfected with hypochlorite, then neutralized, and then you can flush it down the rinse. Since because you don't have any liquid disinfection units, or there is no such management, but you can pour down a lot of water and then it can go into the municipal sewer.
Okay. Ma'am, what is the role of pangolin in spread of COVID-19?
Well, pangolin is a mammal, and as you know, it is a very, very, it is the intermediate host from the bat to the mammal, where from the COVID-19 has come, and it is supposed to be the intermediary host. So it needs a host in between, where it has jumped to the human being.
Ma'am, what should be the percentage of population to be immune to have herd immunity?
Well, for India, it is around 70%. That once we have a 70% herd immunity will be there.
Ma'am, we have a question from Kulbhushan Chauhan. Can we use country-made ethanol for hand rub?
But then it should be, the percentage should be fine. That is, it should be more than 60% country made. Country made, we have the local, I mean, does it mean local?
Ma'am, he has asked that can we use country-made liquor ethanol for hand
Oh,
rub?
liquor.
Yes,
Okay.
ma'am. Country-made liquor ethanol for hand rub.
Okay. So that is the misuse, that is the abuse of actually alcohol,
Yes,
what we are using.
I think, ma'am, you've answered all the queries, ma'am.
Mhm.
Ma'am, one more. Ma'am, we have a query from Vikrant Gupta from Mandi. When a patient recovers from COVID infection, is he vulnerable to get infected again? And till what duration is he contagious to infect others after recovering, as seen in countries like South Korea?
Yes, a secondary infection can take place, and it is the same pattern that it can remain infectious. And though we can see that the infectivity rate has come down, and in a closed, there's a recent article, very recent article, that they say that in a closed, in the household, the secondary attack rate has gone down. But yes, it does cause infection, and there can be a reinfection because there are several, recombinations which are taking place, so we can have a reinfection of the coronavirus.
Thank you, ma'am.
Thank you so much.
Thank you
so
very much, ma'am.
Thank you.
Rajiv ji, एक second. थैंक यू वेरी मच. आप सबका धन्यवाद. आज आपने ये सेशन में लॉग इन किया और आप में से काफ़ी लोगों की ये क्वेरी आ रही थी कि आप चाहते थे कि मैम अपनी पीपीटी शेयर करें. तो मैं आपको बताना चाहता हूँ कि इसी यूट्यूब चैनल पे ये सारी मैम का जो पूरा सेशन है ये रिकॉर्डेड रहता है. तो आप बाद में भी जब चाहें ये रिकॉर्डिंग देख सकते हैं. थैंक यू.